start peptide and when it can be in full performance?
Ben sizlerin şimdiden biraz yoruldunuz, siz biraz sıkıştırdıklar olsanı. Ancak bugün yeni mevzumuz var. Nasıl ki biz öğreneceğiz ki necə biz idmancımızı yeniden öz öğrencilerine ve yarışmama qaytarırıq.
But in the beginning, I gave you task yesterday. So I suppose that the first part will be a little bit like brainstorming of the case studies and case reasoning. So I'm really looking forward what you've prepared for us. So who would like to be the first? And perhaps if it's comfortable for you, you can explain to your colleague in Azerbaycan side will translate it to English.
Sizler necə rahat istəsəz Azərbaycan dilində, sizin də sizə İngilizcə rahat təqdim edək.
Okay, come.
But I don't have a colleague. But I've got a topic related to mental health and fracture. After a fracture, a patient can come to us with pain. It may be likely after you take off the cast. What can cause this? Maybe some ligaments, or maybe some movement disability, I guess. He doesn't have the mobility he needs to. So what we do first is some training. If someone comes, I can show you.
Uşaqlar, model lazımdır bir nəfər çəkməyə sonra.
So, the patient can use his toes like this, just upward. It will help to manipulate the blood pressure in this area. So,
Orxanın danışıq opsiyonlarında hansı ki, ayaqda baş verən sıxıntılar və ya daha özələrindən sonra müalicə prosesini danışır. İndi özellikle ki, əgər xəstə model kimi öz barmaqlarını rahatlıqla dilətləndirə bilirsə, bu onun üzərində işləyir olur. Hansı ki, bu onun ayağında qan sirkulyasiyasını artırır.
So the second one, just this movement, dorsiflexion and plantar flexion, will help the patient cover the mobility for their metatarsal burden. The third one, can you do circles?
Sonraki mərhələdə isə biz çalışırıq onun ayaq nereye yəni aktivləşdirə, hansı ki, dorsifleksiya, plantar fleksiya və bundan daha rahat şəkildə edə bilirsə, ayaq nereye dairəli şəkildə ondan qarşı edir.
And the other one
So may I just, it's perfect what we do. Perhaps I can just recommend you. If she'll bend her knee and she'll put the leg like that, then all the ankle is free for full movement. When it's here, it's with resistance of the mat or table. So she can make easier the circles. And she can observe it, and we have visual control.
Belə ayağın sirkulyasiya, ayaq dərində sirkulyasiya şəkli pasiya və ana məsələdir. Hansı ki, bu vaxtda həm uşaqqa ayağa bağlı olmaz, həm də ki, pasiyent özü güzel olaraq öz verdiyi hərəkəti görüb dərk edə bilər.
Try imagine that there were the fracture somewhere here in metaphysics. So if it was in immobilization, we can say that all muscles around will be weak, and perhaps there will be lack of the mobility of each metatars like each other.
Əgər məsələn sürüsü olaraq metatarlar sürüləri hansı bir sınır olsa, bu zaman ayaqdan olaraq mobilizə olmuş olacaq və bu vəziyyətdə bu hərəkətin bu prosesi olması həmin sürülərin bir-birinin arasında
are used in our physiotherapy, firstly, to do some manual techniques, to release the blockages, to check if the heel is moving and fully mobile. Because try imagine, if there is no movement, how stiff it will be and how the proprioception will be affected, as you said. And then I can use anything which will provoke exteroception and proprioception. Sometimes fast, sometimes I can use even some vibration, some traction, which will really deeply affect proprioception.
Bu vəziyyətdə hansı ki, kimsdən sonra həyatda çox uzun olur və sizlər bir arasında mobilliyi için onun yolunu düzəltmək üçün
Okay. Show us.
Okay. I mean, she can put her leg like this, and by his hand, she can switch to the side of those direction, which will help her relieve the pain and increase the mobility.
Perhaps, but look in her position. It's for someone who is elder, perhaps this position is not available. So or we can do it on the floor. So if you stand, we can do the stretch just very easily this way. If you'd like to stretch triceps, and we can do like go on the tiptoe, go back, go on the tiptoe, go back. Yeah. And it's without a load. So even in the moment when our patient can't have a load on that, I can do these exercises.
Bu vəziyyətdə olan qaçıqların
She can co-pilot.
ancaq bu pasiyent üçün biraz
And total.
özünü icra edeyim. Bu həmdə arxa xəzərlərin, ayağının arxa xəzərlərin dartılmasını təmin edeyim,
Okay, if it's already possible to load it, we can do these exercises. If not, what's your name? Sarah. So please, Sarah, sit here. We could make the exercises like that she's trying against the resistance, do the movement. Perhaps this bend is not the optimal one. And if you know the muscle energy techniques, you can decide it. If the main activity will be against the resistance, or if your activity will be like slow breaking the movement backward.
İki istiqamətdə irəlilərik. Bir, doğrudan fleksiya vəziyyətindən plantar fleksiya özgərdir, ya da ki, plantar fleksiya vəziyyətindən yavaş-yavaş ağrıya geri hərəkət edə-edə şuta qarşı rezistans verə-verə geri hərəkət edə-edə.
So you can work in muscle energy techniques in which or you are like straightening in concentric or you are straightening in eccentric muscle contraction.
Əzələlər kontraktürasını biz eksentrik və konsentrik məşqlərlə burada bayaq göstərdik. Birinci konsentrik, ikinci isə eksentrik geri-geri. Bunları bir-birlə
And generally, when she can't load the leg, we do everything in open kinematic chain. It means she's not supported here. She'll do it like in open chain, and in the moment when she can load it, we start to do activities which will be in closed kinematic chain. Do you understand these two terms? No? Any activity or muscle work can be described based on the place to which the direction of contraction is. So we do the movement which are in open kinematic chains. It means that the peripheria is free, or we'll do the exercises in closed kinematic chains, which means that this is like punctum fixum, it's place which doesn't move, and what's moved is the core or the trunk. So it's very important. Then you continue with what you propose. Okay.
Let's continue with stability. For stability, the patient can do one leg stance. Can you do one leg stance? It's a common test that's always used for stability, and it's very useful, I would say. The patient, it depends on the time period that how can the patient can stand on one leg. It's very crucial. And the other one is you can do it by your eyes closed.
Okay, it's too difficult for her. Organ offered very good assessment, which we've done here, and now your goal is to decide what will be important to measure, the number of seconds she's on that, or we will evaluate something else. Could you see the performance? It's difficult for her, and she's losing the foot arch with like falling down to the medial part. So that is her limitation, and that will be the goal of our therapy, for example, in this moment. So try to offer one exercise which is proper for this instability.
I would say total heel is perfect.
Okay.
Can you do total heel? No. You will raise your leg forward. No. Forward to toe. Calcaneus will be in front of the toe. Yeah, like that.
Could you see something which makes this exercise like a non-quality? She's all the time
Trembling.
Yeah, it is. One very important rule: if she's not able to do it in a poor stance, static, then in dynamic, it's definitely more difficult. So if I say, of course, we can a little bit straighten the muscles this way, but I am scared about instability, and I would try to do something perhaps in the beginning more static. I think it's a little bit of perhaps hypermobility, and we can discuss it. So in this case, I would ask Zara to be highly focused for activity of the foot arch, as we done it yesterday. Try to make like short leg or short foot, and keep it. Keep here. Keep all the time this one, and go to tiptoe just with this leg, just to tiptoe, like flex this way, and keep. You can see that in this situation, she can for a moment control the quality. So try the second one. The advantage is that I will not change the full wide on one side, because I let partly on this tiptoe, so she can control it. So it's like first step. Unfortunately, our patients are non-patient. Oh, it's not exercise. I like to jump, but if we like to reach the quality, we have to go step by step from such a small exercises. Try. But every patient is different, and you have to check it all the time. Do you have any question to such a case solving? So then, thanks Orkan and Zara. It was very nice. So who else? About the diagnosis you've chosen yesterday. Okay, come. Are you fine after your fall?
Yes, I am.
Your name is? Ophelia. And teacher.
İlk növbədə bizdə sakroiliakin ağrılarından danışırıq.
Sacroiliac joint blockage.
Birinci testlərdən başlayacağıq. It's pain. Bura kompresiya edirik çanağın çıxıntısına. Burada da dizimizə. Compression. Və ağrı hiss olmuşsa, deməli həmin nahiyədə sakroiliakdan olduğu göstərmişsidir. Ondan başqa bir əmrədir. Başqa bir əmrədir. Bura geçir. Yenidən dizə kompresiya göstəririk, çanağı saxlayırıq. Ağrı hiss olunursa test pozitivdir.
Okay. These tests are fine. They are not fully specific, because in case of this crossed situation, you are reaching as well the adductors, so if they will be extremely shortened, they could limit it. For this assessment with extension, it can be a lack of elasticity of iliopsoas or rectus femoris, but generally they will be changed in SI blockage.
Bu testlər yaxşı testlərdir, amma daha xüsusi olmaq yaxşılardır. Hansı ki, birinci testlər yoxladığımız kimi adduktorların qısalanda olan testlərdə o testin düz göstərib nəticəsinin düz olmaması qeydimisaldır. İkincidə isə epsilon səviyyəsinin olmağı bizə anladırır.
So Ophelia found that there is a SI blockage. That's very important. It's great that she started with assessment, because now she knows if it's on right or left. Choose one. And what we'll do now?
In this test,
And therapy. Yeah, okay.
And in therapy, məşqləri indi necə göstərəcəm?
Anything. Anything's yours. So it's mainly stretch of piriformis, I would say.
Çünki burada piriformis ihtiyacın olur. O da
Okay. And this is for objectives training. Okay. Great. I can show you out of the context one exercise which is great as auto-mobilization. Do you understand auto-mobilization? It means you know that suffer with SI and you can alone at home make mobilization. Try it at home. If you flex your knee and then make full abduction with a little bit of rotation of the trunk and then try to relax, then you will feel that in this area you can really make traction which can allow like a mobility of SI. Of course, we would do it on both sides, but generally these which is more affected. And there is one more auto-mobilization. I'm scared of these tables, but I hope that I can solve it. It's a situation in which you are in this position and you make relaxation with the wide of your leg this way. And now there is traction on my SI, so I can use it as the way to make auto-therapy.
İki göstərdiyi hərəkətdə insan özü üstünə və söndürüyor fonlarını artırır. Hansı ki, birincidə ayağını qalığına doğru atır və öz bədəni də ayağına doğru əyir.
Flexion and then rotation in this situation.
Gevşətməyə çalışır. İkincisi isə yatağın qırağında dizini boşluğa vuraraq sakrıyla tutduğuna biraz gəlir. Bu insan öz-özünə, başqa bir insan tərəfindən kömək olmasa daha etkili.
So now we release the blockage. There is a free mobility. What we'll do next? Perfect. don't forget that if there is a blockage, it's not just without a reason. Usually it means that the masses around were not sufficiently in strength or in coordination, so the joint was blocked. To fix it, if you release the blockage, then you have to straighten the masses around to keep the stability in the area.
Səbəbsiz yaranması kimi sakromotorların təmin əzələlərinin zəifliyi və düzgün işləmə səbəbindən yaranır ki, uzun kompensasiyaları orada olmalı. Əgər biz bloku aradan qaldırandan sonra mütləq şəkildə əzələlərin düzlənməsi təmin etməliyik ki, onların hərəkəti təmin olunsun.
Very well. That's clear. And if she's fine with that, we can make it more difficult for her. So, yeah, use control your shoulders, make a little abduction, upright here a little bit, and now do the exercise. Or I can make it really hard. Elevate your arm and now try. Oh! So you can see how we decrease range of motion because we'll make it really hard for her. Thanks, you are great. Okay, so our glutes will be activated properly. Okay, just for a lot of patients, that will be too difficult because this position will make hypolordosis because of poor stability when you extend the lower leg. She is able to do, but in our patients it will be Great, thanks. Do you have a question to this case? So, because we could see in SI, it's a very important place where proprioception can be like collected for our brain. So if there is a blockage, it will affect all the stability. Thanks, girls. It was very nice. Okay, come.
That problem is glutes stability, and they have to show some exercise for him. Can I do that?
Sure. The strong one?
No, that's not.
That's right. They prefer this color. I'm sorry, I will stop you. How have you diagnosed the weak gluteal muscle?
We do it before, like yesterday.
Okay, could you show us the assessment? Thanks. Because don't remember that you should treat only what is assessed.
Look. It's off.
No, it's not. We could say it's not proper, but force you to thinking how you know that the problem is only in gluteal muscle.
Burada spesifik olarak necə bilərik?
Okay, left side, I think today I'm going to show you
do you know some muscle strength tests for gluteal muscle? Do you know any? Come to show us. Of course you know. Okay. Please go to prone position.
Uzan, o göster ama sen önce kaçın bunu oluyorsun.
Are you sure? To prone. Or no, on sideline? Yeah, sure. So now we are dealing with abductors mainly. Medius and tensor perhaps. Okay. And to know. But she does abductors, that's fine. And we have to compare the both sides because we don't know if it's proper. So just let her to do the okay. Or I'll do usually the on your prone on your belly. The easiest way is to do it this way. So try to elevate your leg. Come on. And that's the easiest way for me. Oh, sorry. If it's, okay, good question. If it's knee extended, I am not only on gluteal because who helps? If extended knees, hamstrings. So if they are strong, gluteal weak, I can recognize where's the problem. So that's why if I'll make a flexion of the knee, I am poorly on the gluteus maximus. That's a good question.
Əgər biz açıq vəziyyətdə olsa, bizi ayağın arxa tərəfləri bu hərəkətə qoşulur. Ona görə də dizi fleksiya vəziyyətində ekstensiyası bizə gluteus zəifliyini göstərər.
So let's model situation. Really one side, gluteal muscles generally, even gluteal max, even medius is somehow weak. And now it's your turn.
Davam edir olacaq. Tədris bu arasında. Do it fast, but not that fast, you know, slow.
Okay, could you go from side? They look the same. Okay, come up. Anything what we could improve?
Yeah.
Do it first. Perhaps it's too heavy or too strong for him, but he tried even to stabilize the trunk properly. But this was not asymmetric. It was symmetric one. So when we think that one side is really weak should do specific for one side.
Əgər bir tərəfdə zəiflik, bir tərəfdə varsa, bu hərəkətə iki tərəfdə eləmək ehtiyac yoxdur. Spesifik olaraq bir tərəfdə hərəkətlərdən istifadə etmək. Çiynləri çəkmək.
But in this moment, we are training even the triceps and biceps, and if he is poor in that, we are not reaching the glutes. Okay, and now how we can specifically do just left or right side?
Okay, we can do this, for example. For left side, we can do this exercise. It's not that hard, you know, it's totally good. It's good for reabilitasiya.
Yeah, you can.
You can try different options, you know, for example. You can use this
Could be as well. Yeah. So then you need some more easier exercise. That's true. Definitely, all these exercises are fine. Just think for which situation we prepare him. In his life, he will not do this movement really, because in a wall, perhaps it will not limit him. Perhaps it will be on the stairs. It could help, but try think that almost our athletes and patients, they need to stand. So we should direct our exercises to situation in which we'll prepare them
Can we do this?
for the activities of daily living in which we are like in stand.
Pasif bu hərəkətdə yaxşı hərəkətdir, amma biz bilməliyik ki, pasif nə üçün hazırdır, hansı sürətdir. Məsəl üçün, göstərdikləri hərəkətlər biraz çətindir ki, onların günlük həyatında onlara lazım olsun. Ona görə də biz yanlış da olsa, adifasiyonda olsa, onu ayaq üzərində yapmağa ehtiyacı var.
So you can see how easy to make different level of load. And again, can you try to right hand? Perfect. You can see that in the beginning of the movement, he'll make a little bit of flexion. But I have to say that what we can see here on the foot, it's fine. He can stabilize well. So I agree with you that the main problem is somewhere in the proximal joint.
Görürsünüz ki, o bu hərəkət edəcək zaman, ikinci mərhələdə birdən belə çizgiyi qalır, sonra başlayır həmin hərəkəti özü müdahale etmək. Və mənim də gördüyüm vaxtlar ikisidir ki, ayağının pəncəsindəki vəziyyət kontrollu vəziyyətdir, yaxşı vəziyyətdir. Bu da yəni göstərir ki, problem hərəkətin olunursa çanar hissəsində.
So in compare with Sarah, where we found mainly lack of activity in a peripheria, here we would more focus for the proximal joint.
Zəhərə nisbətən biz zəhərdə gördük ki, onun aktivlik azlığı pəncə hissəsindədir. Ancaq burada bu sürəsində isə daha aktivlik azlığı, pəncənin azlığı çanar və uşaq hissəsidir.
So good performance, guys. I think we could get one more case. But if you feel that it's useful for you, I would like to see one more. Okay. They were one meniscus tear I asked for.
Meniscus test.
She already was. So someone who wasn't already. Okay, you can. But I think you would have an example as well.
Beni sağladı.
Come from this side.
I'm not good at showing tests, but I will try. This one is for checking medial meniscus, and this one is for checking lateral meniscus.
Do you have any other recommendation for her? Because from my point of view, she is more assessing rotation in a hip joint.
I press it.
Come to show us. But you want Come. No? Come. Come. Come to show. It's better because before you've done like rotation in the hip and you need to get there, like the pressure which goes like crossly to the knee. So because
Like this?
yeah, but it's fine, it's fine. It's fine, but you have to then make even the pressure to the meniscus with the rotation of the calf. Yeah? But today,
Bu sümüyünü rotasiya etdirməkdənsə, daha çox tibiya rotasiya etdirmək lazımdır sizə ətrafındakı və bizə doğru biraz da güc sənətləri
finally, you will not make a diagnosis of tear of meniscus. Medical doctor with ultrasound or any other imaging method will do it. But in case that you have a patient with a pain of the knee and you need to decide it, oh, what is it? It's arthrosis, it's LCA or whatever. To think what should be done, then you have to have some clinical test. But finally diagnosis, it's not in the hand of the physiotherapist. Or you can do this. Yeah, that's easiest because you don't need to control the position of all the limb. Come on, we will make it a therapy. Stay there. Come on. Stand. No. Okay, because for meniscus tear, or we need to reach rotation in pressure to the knee. So it's up to you. There is a lot of orthopedists giving the name to the tests, but you need to know the principle generally. So okay.
Bizdə tip üzərində təzyiq göstərərək tibiyanın biz oynamında rəhbəri təmin etməkdir. Bu dəb yolunu edə bilərik, ancaq prinsip deyil.
Okay, now we know that on one knee is... Okay, diagnostic is done and we'd like to do some exercise. So let's make exercise. What will be in case of meniscus problem? inner system in disorder? Sure.
To make the less pressure for the knee.
Perfect. So try to show one exercise. But she let's say that she's ready to sport, so try to make something challenging for her.
We can do balance.
Okay, show some balance exercise. What do you need?
Can I use that?
Yeah, sure.
Let's imagine this is balance.
Explain it to her. That's a soft skill which you as a physiotherapist needs to train every day. Not to do it, you have to be able to perform perfectly what you'd like your patient does. And the second, you are a teacher. You have to explain how to do it.
Bir fizyoterapist gibi her zaman bunun yanında olduğunu düşünüyor. Fizyoterapist nasıl görüyorsunuz?
Oh, okay. So, very complex, may I ask you? Come to show her. But again, we will really control the quality. So, very nice. So, keep the position. And if we like to make it more concrete for the rotations, I'll ask her. Throw it to me here. Because then she needs to make a rotation. So, okay. It's extremely difficult, but good idea. And we could start step to step to increase the exercise. I think that we need to continue. Okay, one more. One more exercise. Thanks, it was very nice. Okay, come to the table. Your name is Isa. Okay, lay down, show us. She proposed this exercise. Show us on this. Press the ball. What we could say about this exercise?
Good for the first stage of post-surgery rehabilitation.
It's like a very low level of exercise because it's in open kinematic chain. It's very analytic. There is no complex movement, so we are focused just for rectus femoris activity. So it's fine if you have patients who can't load the leg and you need to facilitate the activity. Generally, if we'll work with our patients, okay, one rule, thank you, please. If you can, try to do more complex movement than just abduction, adduction, or flexion, extension. Try to connect them to some diagonal or rotation. That's really important. In our life, nothing is just in 2D. Everything has a 3D performance. So if she's in the situation when she can't stand on the leg, lay down please. A little bit more there. So I can do exercise which will be more complex, like come a little bit perhaps from their side they could see it. And I can ask her, try to extend the knee and turn the leg together and relax this way. And come again. Turn, but turn it. Turn.
Həm ayağımı döndür.
Extend and turn this way. And do it in a 4 range of motion. Come on. Higher. Okay, and back. And you should finish here in a full rotation in eversion, and here will be in a full inversion. And now we put all the complex of all muscles which cooperate together. If I'll do just flexion or extension, they just flexors or extenders working. When I will make it together with rotation, the muscle chaining is very complex and very effective. Thank you.
Bayaq göstərdiyimiz sadə hərəkətlər normal həyata uyğun faydalı deyil. Misal üçün, hər hansı bir hərəkəti tətbiq etdikdə sadəcə bir tip hərəkət növündən istifadə etmək nəysə, müxtəlif bir hərəkət növlərinin bir kombinasiyası ilə hərəkətləri tətbiq etmək daha məqsəd olur. Çünki biz həyatımızda robot kimi hərəkət edəmirik. Yəni, düz xətt üzrə gəlmirik. Biz hansısa bir adi gəldikdə belə müxtəlif hərəkət növlərinin kombinasiyasından istifadə edirik. Ona görə də xəstəyə, pasientə hər hansısa bir idman tətbiq etdikdə bir yoxda bir hərəkət növlərinin kombinasiyasını tətbiq etmək daha məqsəd olur.
So anytime if you propose the therapy, try to think if you could do some rotation, some trunk turn, so it will be very helpful. But every time with the proper quality of alignment. If the rotation make flexion together, then I have to go back just to sagittal plane.
Əgər adi bir bədənimizin yanlara doğru rotasiya istədiyi edirsə, bu daha yaxşı, yəni əla edir. Ancaq bu hərəkəti düzgün qoyulacaq, icra etmək lazımdır. Əgər qamətimiz pis vəziyyətli bu hərəkəti icra edirsə, bu hərəkəti eləməyin heç bir mənası yoxdur. Yenidən geri qayıdıb, öz qamətimizi düzəldir. Qamətimizi düzəldikdən sonra hərəkətə başlamamız daha məqsəd olur.
Do you have a question to this, like case reasoning or exampling?
Bu situasyonlarda nasıl bu sualınız var?
So fine, I am prepared to answer even through some breaks if we'll have some.
Fasilərini istəsəniz, yaxınlaşın sual verebilirsiniz.
Now I'll go to the topic which I prepared for today. We'll make a theoretical background in the beginning, then I'll give you the break, and then we'll do the practical skills.
Birinci olarak nəzəri istəyəcək, breakdən sonra aktivite.
It's very important mainly for athletes to recognize in which moment our sport athlete is able to go back to the training or to the full performance.
Bizim üçün vacib olan bir hissələrdən odur ki, biz bilməliyik ki, xəstənin hansı vəziyyətində o tamamilə öz məşqlərinə və ya performansına qayıda bilər.
I understand their will to go back to the activity. Perhaps there is a trainer saying, if you will not come for this match, you will never ever have a role in this team. So it's really even hard psychological pressure to the athletes.
Bu əslində praktikada da çox ağır bir məsələdir. Hansı ki, idmançılara qarşı psixoloji təzyiqlər edilir məşqçilər tərəfindən. Hansı bir oyunda əgər müəyyən bir vaxt ərzində çıxmasa, onu digər məşqlərə biz buraxırlar. Bu çox pis bir hal.
So sometimes they are really frustrated by that, and you have to have some tool which could show them there is a level you need to reach before you can start to do some type of activity. If you are not properly in this level, you can't start.
Bu vəziyyətdə idmançılar çox buradan düşür, ancaq bunun ardından qaldırmaq üçün onlara bir göstərməliyik ki, o öz performansının hansı səviyyəsində komandaya qayıda bilər və öz işini görə bilər. Bunu ona göstərməliyik ki, o hara qədər çatdırmalıdır.
So this protocol was translation of all providing of the test, but you can find the primary source here in the link, and it's in your paper as well. So we are looking for some objective protocol to say when we minimize the risk of future injury of athlete in case of the pain or some injury which we are solving with physiotherapy.
Bu protokolda hakkında daha önce gələcək zədələnmələrin qarşısını almaq üçün olan bir protokoldur. Ya az terapidə almaq, ya da hazırlanıb bunun aşağıdakı linki, bunu protokolu əldə etmək üçündür. Bu kağızın da bir kağızlarında olmalıydı.
So try imagine that if a football player goes for LCA plastic, then will be some team of medical doctors, of physiotherapists who take care for him. And in one moment, he will be able to walk, but we don't know when he can start to train. And I feel that your role could be this like transmission between the basic physiotherapy to the training and exercise which are more focused for sport.
Hansı ki, misal olaraq ön çatırtmanın zədələnmələrindən sonra müalicə olunur və hansısa bir vaxt gəlir çatır ki, bu həmin idmancı yerəyə bilir. Ancaq biz bilirik ki, o halın hansı var, hansı haqqında öz məşqlərinə qayıda bilər. Bizim işimiz də budur ki, bu vaxt ərzində bu arada onu öz idmanına hazırlamaq ki, o idmana qayıtdığı zaman yenidən zədələnib pis hala düşməsin.
And you perhaps could be like mediator, if you understand the word, which will be able to explain to the athlete what's necessary, to be able to explain to the coach why he can't or she can't make full training, and perhaps to communicate with the medical doctor whatever could be done for better healing or the process of the rehabilitation.
Arada bir mediatör olmalıdır. Hansı ki, vəziyyəti birinci olaraq idmançı izah edəsin və ona izah edəmək üçün hansı vəziyyətdə o, hansı səviyyədə performans əldə etsə, o qədər məşqlər və bunu ikinci olaraq öz həmin idmançının məşqçilə izah etmək lazımdır ki, o da vəziyyətin hansı yerdə olduğunu anlasın.
It doesn't work anymore. Tired as well on Friday. Sorry. These authors divided general sport activities to the 4 levels. One which are without jump, so there is no necessary any protrusion and high dynamic in a performance. You can imagine the golf as a typical example. And we can say that every time we are trying to make some picture in activities of daily living. So for the golf, you are on the level like climbing the stairs, going home in the building.
Bu cədvəl nədən ibarətdir? Bölüşmək üçün hansı ki, vəziyyəti. Birinci mərhələdə isə orada misal olaraq idmana uyğun aktivasiyalar, bunlara golf məsəl üçün misal göstərmiyorlar və günlük aktivasiyalar orada göstərilir. Hansı ki, birinci mərhələdə otlanmaq kimi daha aktiv hərəkətlər olmamalıdır. Pilləkən düşüb qalxmaq, günlük gəzməyə dolaşmaq, işlərlə məşğul olmaq daha məşğul olur.
So the second level has some dynamic component in the sport. So you can imagine as a dynamic, which is not influenced by someone else. It means if you run or just jogging, it means that you have control on your performance and there is no one who will come and push you, or you don't need to change very fast the directions. So that's the second level. And on the work, it's someone who needs to walk a lot during the day, but don't need to do some like extra switches or changes of directions.
İkinci mərhələ biraz dinamik mərhələdir, amma sportda idmana yoxun olanlara baxsaq, orada qaçış və ya bunun kimi dağda gəziş kimi, bunun kimi misal göstərə bilərik. Ancaq burada qıraqdan hansısa bir təsir olmamalıdır, kimsə sizə gəlib tənəməli, yəni bu cür risklər olmamalıdır. Hansı ki, siz özünüz tam etdiyiniz hərəkətin idarəçisi olmalısınız. Günlük həyat tərzində isə yüngül fiziki işlərdə istifadə edirlər. Çoxlu gəlməyə, hansısa evdə bilməyə, dəyişiklər etməyə, amma ağırlı fiziki işlərdə mütəmadi məşğul olması hər iki mərhələdir.
So, we said in the first there is no dynamic, in the second is dynamic, but without the changing of directions. In the third, we have already the movements which you have to change the direction, but there is no risk of impact of anyone else. So there is like individual sports like tennis, squash, or these where you have to be very fast, you have to turn and change the position, but there is no risk that someone will hit you.
Üçüncü mərhələdə dinamikanı daha da artırır. Artıq bu mərhələdə biz yönləri daha tez-tez reaktiv olaraq dəyişə bilərik, daha reaktiv hərəkətlərdən istifadə edə bilərik. Ancaq o deməkdə ki, kimsə bizi qıraqdan təsir edə bilər. Yenə də individual olaraq öz hərəkətimizi özümüz kontrol etməliyik. Buna misal kimi tenis göstəriciləri, hansı ki, individual idman növləridir. Burada heç bir qıraqdan sizə gəlib, heç bir imkanı təsir göstərməyəcək, amma yenə də dinamikliyi artırır və daha reaktiv istiqamət dəyişiklərindən istifadə edə bilir. Amma ev işlərində isə nisbətən ağır fiziki işlərdən məşğul ola bilər. Yer veriləmək, hansısa bir əşyaların yeri dəyişmək kimi misal göstərir.
In occupational level, it's someone who works hard, like a fire worker, but there is no high impact that's it. And the last one, it's very dynamic, with a changing of direction and with risk that someone hit you, and without your control, needs push you to have stability which is really completely optimal. So for the typical, it's football, basketball, the highest are like rugby, for example, where they have to be completely well prepared that someone hit them and they don't need to relax in the moment. And this level is compared as a high military performance.
Dördüncü mərhələdə isə gücü tam aktivasiya çatdırır. Burada bizdə nasıl olmayan təşkillər var. Hansı ki, futbol və basketbol, idman növlərində siz nə qədər öz hərəkətlərinizi idarə etsəz də istənilən halda qıraqdan hansısa bir təsir ola bilər və bu ən ağır mərhələ kimi sayılır. Bu cür fiziki hazırlıq varsa, bu cür artıq ordu səviyyəsində fiziki hazırlıq sayılır. Ev şəraitində olan insanlarda məsələn bu əsərlərdə görsənir.
Great. And the system of this protocol has like levels, saying if you reach the level 1, then you can play golf. If you fulfill the level 2, you can start to do some jogging. If you fulfill level 3, you can play tennis or squash or other sport like that. And in the level 4, you can go to the full performance. Important is that this protocol has in every level two tests. One is quantitative and one is qualitative. Last sentence for that. First, you have to do qualitative test, and if it's proper, then you can try to do quantitative.
Bu mərhələlərdə biz idmançıya izah edə bilərik ki, hansı kəndi sözü hansı mərhələdədirsə, ona uyğun idman növlərində məşğul ola bilər. Bunun üçün idmançımızın hansı fizik aktivliyi mərhələsində olduğunu testlər vasitəsilə yoxlaya bilərik. Kvantitativ və kvalitativ testlər var. Birinci mərhələdə birinci olan kvalitativ testlərdən istifadə edə bilərik. Əgər kvalitativ testi uğurla keçəndən sonra kvantitativ testlərdən istifadə edilməliyiz.
In a quality is in a level 1 balance sport. If the athlete is not in proper quality, then goes for rehabilitation. If it's proper and passed, make Y balance test. If passed Y balance test, then can do go. If it's failed in Y balance, go back to the rehabilitation.
Birinci mərhələdə biz yoxlayırıq hansı kvalitativ testlər olmalı, balans testindən istifadə edirik. Balans üzərində istifadə edirik. Əgər həmin testi keçə bilmirsə, artıq bu qaydələrdən rehabilitation. Əgər balans testini keçəndən sonra, onun növbəti mərhələdə kvantitativ testi yoxlayırıq. Y balans testi, yıxətlikdə olan dünən aşağıda var idi, qırmızı onu test edirik. Əgər onu da testi keçdirsə, onda uğurla qol koyulmağa gedə bilər. Əgər Y balans testi edə bilmirsə, yenidən qayda test yaparsınız.
So it's like a real algorithm. You'll go for qualitative test. If not, go to rehabilitation. If yes, quantitative. If no, rehabilitation. If yes, go to the level 2. So it's all the time turning this way. So we could say functional test, failed, rehabilitation, level 1 testing if passed, if not, rehabilitation, and it's turned all the time in the cycle.
Bu üstü klasik gibi, mesela bileşenden çıkıyor görevleri. Rehabilitasyon başlayırıq, yoxlayırıq hansı bir testi. Əgər bir şey seçələri testi keçirir, keçəbilməksə yerdən qədir rehabilitasyon prosesi. Birinci mərhələni keçdikdən sonra, birinci mərhələni keçdik. Əgər idmançımız istəyir ki, dərslə məşğul olsun, biz keçirik ikinci, üçüncü mərhələlərə və onların özünün testlərini tətbiq edirik.
And we can say that even the rehab exercises will be in 4 different levels. We showed it from yesterday. We are working on quality and like building the performance. So someone who will be in a level 1 will do just exercise on the level 1, but someone who is on level 4 has to be able to do all 4 level exercises.
Yani bu pillələrin özlüyündə də hansı bir çətinlik mərhələlərini göstərir. Kimsə 4-cü mərhələnin performansını göstərmək istəyirsə, 4-cü mərhələnin özünə uyğun olan çətinlikdəki idman növlərindən istifadə edir.
So we'll go through the test, but and we will put together which type of exercises you can do because it's important for you. If someone can't pass this level, which type of exercises I'll provide with him.
Burada isə göstərir ki, əgər hansı bir bu mərhələyə keçə bilirsə, hansı bir testlərə yedirsə və yaxud da növbəti mərhələyə keçmək istəyirsə, onun uyğun olan hansı hərəkətlər icra etməlidir, onları göstərir.
But generally, we can say why the healing becomes, we can put more function in a time. That's clear. In a weeks after the surgery, we will increase the amount and load of the exercises. It needs to be a little bit experience how to deal with complications, how we deal with the pain, and every time we have to check if there is no inflammation in the area, all these typical signs. And you should not do the assessment if your patient doesn't have muscle strength test. We said according to under 4. I don't know how you assess in the scale, but it means that reach 75% of the muscle strength.
Burada cədvəldə qrafik göstərilmiş şey, nə qədər daha tez sağlanırsa, bu bölümlərdə cədvəl sıxıntıları faktı azalır. Hansı ki, biz bundan əvvəl xəstənin əzələ güclərinin öz zədələnmiş yerlər olan vəziyyətin müəyyən edildik. Onlar ona baxmır. Bu əzələ uçanal testi isə yanların 4-cü pilləsində olmalı. Hansı ki, 75% əzələ gücü tam əlbəsində olmalı.
Okay, so I think that I'm losing you. You need to coffee or tea, it's definitely seen on your eyes. So let's meet here in 15 minutes and we will start to provide the protocol. Yeah?
verəməyəndə siz yox, yazsın. Digər komandaya başlar. Orada da birinci yanınıza gəlin, birinci hər levelin 2 dənə mərhələsi var. Matematik və kvantitativ. Onları mərhələ şəklində öz performansınızı göstərir. Komandada onun üzərində edirsən. Kim daha çox level'a qalxdı olur.
So you will need to write the results and count the results because we have to all the time compare the both sides. So for that it's called like lateral calculation formula, which says if you reach on left 80, you are able to do 50 on right. Is it plus minus 10%? Then it's okay. If it's more than 10% difference, then you didn't pass.
Bu testlərdə 2 ayda yapılmaq lazım. Hansı ki 2 ay arasında ancaq %10% fərq ola bilər. Əgər ondan çox fərq varsa 2 ay arasında, həddi sağla sol arasında məsələn 20% və daha çox fərq varsa,
proper. Okay. Try to really be sure that your knee is in proper alignment. Not to fall down. Could you see the trajectory? Okay, show me the second one. I don't know if we all sent him to the second level, to the test. Don't you have anyone who is backward? But no, it's not good. You go this way. Okay, come and perfect. It's proper. Okay, what if but so try to just concentrate for proper correction. Okay, fast. So now we'll go through the test. Your team will write the size. So come. Start with the left one. Do you have a paper? You'll be using it. Yeah, there and now after that, and we will test this leg. Left leg starts. So twice from with no fall. If it's fall, then you finish.
Fiziki fokuslanan İngilizliği.
Try to go from 70. One more. Nice. I will start. 72. Turn by this leg to the yellow one.
135'e çevirin.
And the same pass.
70'də saxla, çox şey eləmir.
99. Once more. Faster again.
Okay, wait a second. Don't worry.
99 is red. So then you'll go to the orange one. The same again.
Ayağı değiştirme.
Dəyişdirməyin beyin ayağı.
Come on.
Doksan
95.
bir dənə dənə.
Once more.
Okay, wait a second. Beni panikle salmayın. Don't panic.
No, you were more here. So the previous result. Okay. Do you have a result?
Yes.
So then the left leg. Come on.
Sol ayaq.
We are not here for the weekend. Come on. Take the second leg. Left one.
Also left one yapmıştım.
Sol ayaq dənə.
Here. You can no front this way and twice. Oh, come on.
Karıştırdım da səhv elədim. Ben göz görmedim.
Bu sol ayağını yere koy, öyle bir sonra.
85.
75, but not properly.
85.
Olur, test bizə.
71.
Two.
Turn. 71. Turn to the orange one.
Bak bunu elədim de onu deyirəm, səhv oldu.
Sen değere
Put
bak.
your heel right way.
En azı görünmədi.
I can say it.
Dedim ayağını değiştirdin ama.
No. Again, too much supported there.
Çok üstüne düşmedi ha.
Try better.
Dokundur çək, üstündən yük bu.
Düşmürəm
No.
ha.
Try not to touch.
Okay.
Fall. No.
What for?
Yıxılmayalım da.
You have to be able to go back. 86. Okay. Turn to yellow
Like this?
with the heels.
Okay.
92.
Bir dənə də, ya Allah. Bu saat jackpot vuracağım.
93. So you can count it and make different for left and right. There now. So left hand.
Hesaplı
70. 72. 10.
Tangent ve start sonrası məhv edəcək. Oha!
90, but try not to step there, just touch. 91. But 79. 85. I would say. The opposite one. You see the difference between men and women. And it's just how fluent it is. 74. 74 as well. Okay. 84, but try not to step there, just touch. 85. And the last one? 80. Oh, 92.
92. I hit 93 before that.
But do not compare your results. Just left and right side of you and her. So count the difference.
Gerçekten çok teşekkür ederim. Gözde.
There once more.
Sen fokus.
Try to just make it. But you have to come back to the other.
One tepede.
Neyse ben
75. Be careful about these steps out.
Üstüne basma. Topundur çək. Çək.
But yeah. 97. How does verse? Is it more than 10%? Okay, but try really. We are not reaching the maximum, but maximum in quality. So what we are able to touch and go back.
Üstüne basma.
recovery process for 5 months.
It's not fair.
Recovery process for 5 months. Nazri.
Yeah, that's 5 90. Very nice. Okay, the second line. So each group, ready? So they count if you can continue the exercises. And I think that all of you passed. All of you passed, and now you'll make a square 40 to 40 for the next test, because I would suppose that you continue. May I ask you? Put it somewhere on the floor. Come here to make your own square. Come on, please. I don't know if it's but it's near to the camera. I don't know if it works.
Aynen oranı göreceğiz.
Yeah, you can sure. Each group should have own square.
Square. Okay.
Like that.
O kız orada yerleşiyor.
Çok sağ ol.
Biraz belli bekle koyarsınız ki bütün o arayanda göreceğiz.
They have it here for 1:30. So if you don't have a mat, it's very easy to prepare conditions. Listerine, I was in PSE, and they have it the same way on the floor. So, are you prepared for a second?
Give me some, please.
One more? Fine. Yeah? So, great. Now, so you are on the level 2, which has some proposal of dynamic. So, there will be balance front top. So you try imagine that you like to go over the 40 centimeters. So it means that you make 40 centimeters and you have to stay 3 seconds after that. These are both flags. So what could use even this, because here is as well the scale. So the goal is to go and keep it. Yeah?
Bir ayak üstünde yapılıyor. 40 santimetre böyle kullanmaya çalışırım. Kullandıktan sonra bir ayak üstünde 3 saniye kalmak lazım. Bu sayesinde yaxşı.
Yeah? So, let's check the quality. Tereza will show us. Very nice. The second leg. So she went through the quality for the second level. Okay, but you touched the line. Okay, try to concentrate more for real work. The opposite. Fine, that's better. The opposite one. Okay. Oh, we have another competitor. Okay.
Biraz daha bakalım.
Ondan değiştiler şey.
Geri biz de kovalıyız. Geçeri ikinci.
Okay. Come with the second leg.
Ben de oldu.
Yeah.
Mesela
Oh, the lack of quality. It's windy here, so let's try once more.
Bizde baş düşmedi. Motorlaşmış usta.
And now, try it once more. Now, we are coming. I think the boots are, the shoes are not proper. It doesn't help them. I would say it's because of boots, but yeah. So let's try now. It will be something for competitive guys, because we'll make the maximum of one hop on one side. So here, you will go on one leg. I'll make my better one. And you'll try to hop as much as possible. And we will measure left and right, and we don't want to test difference more than 10%. So come here.
Ayrı bir saniye hissetmek bir sürü saniyesi geç olmalı. Kız olan değil aslında.
Okay. At the most, it's better if you try to try it on one side.
Ömer, ben makyajsız kontrol edeceğim.
Ama siz 30 saniye durun.
122.
Hey, cheating girl.
125. So 122, 125, minimum of difference. So she can continue to the level 3. If you'll be out of the match, you will come.
Oh!
145. Okay. Okay, come with once more or is the second? Left was 145.
Yok, neredesin beni?
40. Okay, come once more on the both sides.
It's not another chance. It's more something. My turn.
Oh, better. 48.
What if I fail? What if I fail? What if I fail?
Yani 30 saniye.
If you fail the previous
Hələ protokol konuşdu.
150. Okay. So, count, there is no
Ben de bol buradan buraya makyaj.
Okay, come on. You 121. Left one.
Biz çox sakit uşaqlarıq, hə belə, yəni. Kömək müəllimə deyə tanıyır da bizi.
Hə, gəlmə.
Bizim heç səs var.
Oh, but it is a fault. So you are a good guard. So the previous was because of a fall. So now the right one. Knee once more. 110. But again, there is no stability, and you should like feel to stand 3 seconds in the end of performance. But, you know, yes, the same performance on both sides. There's no big difference, but the quality is not wrong. So, what was the difference? It's fine. What was the difference? Okay, they are continuing to the third level. I'm not sure with Fatima, but you will see how you will survive. So, the third test is the quality is very start to be difficult because before we jumped front and now we will jump to side. So it will be the jump this way and keep the position. So and you have to be able to do it again to both sides. So from the external part of the square, and you will jump and keep the position. Yes? It's not easy. It's more difficult. So try it if you have I think that all of it seems easy, but it's not. Could you see the all the time? Yeah. Okay, but the goal is jump and stay, not fall. It's pretty difficult. It seems easy, but it's not. Good performance. Perhaps it can be by good performance. You need to count along because the qualitative performance will be for 30 seconds. And we will count these which are fine. We have to count just these which were proper. Just touch the square. And these which are full, we will count that can be more than 1 quarter of that. Side. Okay, so just explain that we will count the number of jumps in 30 seconds, but these which were revolted can be more than 25% in our total jumps. And from these reasons, I recommend if you are alone with athletes, make a video when you can count it later, because if you are one, it's very difficult to count, it will be very fast, you will see. So, this jump we've done, and remind that after the jump, you have to stay in the position for 3 seconds. And now, we will jump the same way from side to side. So, could you show us, please? So, the performance will be for 30 seconds, and he'll go from side to side. Now we start on his left leg. Try to do as fast as possible. Okay. You count which time? Great. No fall. Very nice. No fall. So you can count the numbers of jump and then do it on the right side the same. Come on, let's go. You'll be the one. I think you are the first. So it's necessary that one will measure a time or make a video to be sure that you have you can make it yourself. Don't touch the line. She can stand, but just on one leg. If she fall down, then she have to repeat it once more from the beginning. Okay. Not so easy. It's okay. To make her rest, perhaps. ball play or something, perhaps some hit of the knee could be dangerous. So then we'll go through exercises she could do. Okay, come. It's very long, 30 seconds.
They also better.
Very nice. Very good. Go! Sorry for that. So try it. Perhaps we have here competitors in this group. Are you
Biz eleyen
How was your arthritis? 60 and 11.
This is like this.
Almost I don't know. That's the test you have to do. It's really like, try imagine that's for someone who'd like to compete in some sport game.
baştan kaybettik. Beni yersen. Beni
with the shoes. Handicap. Okay, so is there anyone who can do it properly? Yeah, sure. I can see. It's like in pantofles. Yeah, okay. But yeah, now I would say that who you could go high. Okay. Outside. Ooh. Side is low. Yeah, but it's very good. Okay. So there are some who could really continue to the last level, which is the highest level which you can imagine. And we had in the first just static bend. In the second we have hop front. In this third we have front laterally. And now we have hop with change of the direction. So you will go to the square and you will make like hop, hop. No. Inside, you will go hop, hop, hop, hop. Yeah, or you can do it, yeah. I'm sorry. Hop, hop, hop, hop, hop, hop, hop, hop. So, and you turn like that. very difficult already because we need to keep the stability here. Or we can give her some bend as you done. For example, just the way. Stop that on that. And try to elevate. So now we'll make it harder for her. Okay, but she is just in a basic position. And what we can do to improve the static of the knee class? What you could propose in a vertical position?
Dizin stabiliyeti, statik vəziyyəti forması hansı idman başqa bundan başqa təşkil edirsiniz?
Bir de altına balans böyle kaldı.
Okay, this is almost the same. Take a stand, please. She can be just in front of the wall or in front of me. Take a balance with me and making just some tiptoe and back. Then we can make like tiptoe with bended knee. Perfect. So that's easy. What you can do, because you have no perfect full load on the knee, there is no risk of instability, and you control the performance. That's a level 1, very basic one. If we like to go to the level 2, we know that it's someone who has a problem to solve stability in chest. So we would do some exercises like that. First, I would start with one leg stand. Yeah, no, it's fine. Because now we are training the activities which are in shoes. So I will let the shoes. So I'll start first just with one leg stand, and again, and we have to do a lot of exercises around. Perhaps make it opposite way, 90 degrees. Just go out. And there can be a lot of exercises. Let's find some. Sure. And because we have a dynamic there, perhaps we can make like step on IRX, go back. Or step on IRX and go cross. I don't think so, because if she can't do the qualification test with jump properly, I would not use it on IRX. We have to do it on the floor. Yeah? So these. Like that, or step front, step back. And it can be very dynamic. And if you can have like another task to keep. Try to go with the back legs go, and try to be on the perfect. And you can see, you can bend a knee a little bit. Perfect. So that's what we can do. Another exercise definitely we can do are some squats and small jumps. Controlled jumps. It means with both legs. We can start with the jumps, and you can have different, of course, modifications. If she's fine, we can try assistant on that. That she jumps from the foam downward. That's easier than if I ask her to jump on the foam. Yeah? So, I don't know if it's not moving. Yeah, it's small. It's too small. Yeah. Very nice. So we know that she is prepared for higher performance, and now we'll start to make some side lunges. So we can do the movements to the side. is already able to do, we can make some side hops. So I can ask them just hop over that. So if we do this down with both legs, something like that, perfect. We can make like box jump. So we can make. So then go to the stairs. Okay. So that is everything what you can do. If you know if the gyms are the box, you can use a different size. So this type of jumps is very useful. And if we are in the 4th level, so it means that we are working with national team, so then we'll do all what we done here with some rotation. So we'll make some jump which has change, some switch, have some multitask, or you can do it again like from the box. Then you go, and your result should be this way. Yeah, so that you have some torsion there. So and then you can hop around the world and be champion and right there. So is it clear for you how the levels are? Don't be like sad that almost of us are not able to reach the level 4. Almost of us. And for us it's important to say that we need first start to train the activities of daily living. Then we can decide to go to the sport. But sport as golf, jogging, or easy thing without changing of direction. And then if we are able to make a full training, we are ready to really load our body. And that's important to say. I don't know if you believe me, but if I say, look, your performance is not proper, you can continue now. You have to exercise more in the gym. You have to do your exercises, still you will be able to do it properly. Then you will be successful and your athletes will not be injured a lot of times once more.
Bu göstərdiyimiz sahların hamısını istifadə edərək həm idmançının özünə, həm də məşqçiyə göstərdiyi olar ki, həm idmançının fizikal vəziyyəti hansı bir vəziyyətdədir və başına nələr gələ bilər. Əgər həmən şəkildə idmana qayıtsa, başına nələr gələ bilər, necələr bilər. Bunu həm bir sübut kimi, həm də bir ölçü vahidi kimi, bir sistemi kimi istifadə edə bilərik. Həm öz işimizin funksionallığını, nəticəsini artırır, həm də bir etalon kimi istifadə etmək daha yaxşı olar. Aradakı münasibəti daha da yaxşılaşdırır.
So, that's something what I think is very useful. Perhaps you need just to try and be sure that you improve your own skills to be able to perform the test to your patients.
Bu testləri eləməyə öz ilmanətlə daha da cəhd göstərməlisiniz, tanımalısınız. Sanki ki, siz öz pasiyentimizə göstərə biləcək səviyyədə bu testləri eləmə qabiliyyətində olmalısınız.
Because you will be the example for them.
Çünki onlar sizin nümunəsinizdə, siz onlara düz göstərə bilməsə, onlara özünü düz eləyə bilməlisiniz. Şirin çay üçün başqasını deyə bilməlisiniz də şirin çay üçün.
There is a question. It's for all of us.
Yeah, not all of it. Probably everyone in there has a balance problem, what we should have to do, like this exercise, we should try this every day at home, gym.
Yeah. Generally in physiotherapy, you have to offer this exercise and during your therapy unit to try to make your patient understand and can provide it well without your control. So that's what you train during your therapy. Perhaps you give them a little bit of energy, motivation, but you have to be sure that the exercise you give him as autotherapy, he can do perfectly. And then, as I said yesterday, because we need to change the program in our
həqiqətən də o hərəkətlər yox. Və bu hərəkətləri gün ərzində eləməlidir. Məsələn üçün, bir neçə dəfə idmançının özünə asılı, ona motivasiya vermək lazımdır ki, o lazım səviyyəyə gəlsin, çatsın.
And I didn't catch the question well. The question was what we can do for ourselves.
Yes.
So, exercise. And think about the movement. There are like three main pillars. What I think make my skills in observation of the movement and able to perform something. First is you can watch football, ballet, any sport, any movement. Perhaps if you go in the park and you will see someone who is running like that, you have to think, oh my gosh, what's on? Why he's doing that? What's his problem? And in the moment when you start to think about the movement, you will immediately, rapidly improve your observation and like reasoning. That's the first step.
Məsələn, sözdə bəzi kimsə bir qaçışını, hərəkətini görəndə siz sırası həmən gözlə onu tutursunuz və onun hansı səhvlər olduğunu özünüz beyninizdə tapmağa çalışırsınız. Bu prosesləri özünüz beyninizdə həll edəndən sonra siz özünüzə tətbiq etməyə başlayarsınız. Və bu da amin prosesi keçdikdən sonra bu daha tez olmağa başlayacaq.
And then the second thing is, which will be the same for the patient. You have to try to feel your body and the movement. So in the moment you will be after training or exercise and say, oh, why this muscle is painful just now? It was because of which movement? Could I find some release position? It's kinesiology in practice, in like daily life. So if you are able to do and you go and you realize, oh, my shoulders are up, and you relax them. If you are able to do, then your performance again increase really fast.
İkinci mərhələdə isə bu növ bədəninizi hiss eləmək, nələrə başlamaq. Yəni, hansısa bir hərəkəti istədiyim edin, xüsusi olaraq hansısa bir əzəli ağrıya və ya hansısa ki, yəni, heç bir yeriniz ağrımasa belə, hansısa bir hərəkət zamanı gizli bir ağrımız ortaya çıxa bilər. Öz bədənimizi hiss edib ona başa düşməliyik və onun yolunda sınaqlar kesilməliyik öz üstümüzdə ki, daha biləyək bu səhərdə.
And then just switch it, switch it, switch it, switch it. Exercise, exercise, exercise, exercise. Exercise sometimes. But now last research is giving clear answer that if you are in well conditioning, in coming to an injury or any disease, you have 100% better ability to heal and to come back to become alive. So for everyone, it's better to be well conditioned and come to some sickness, disease, or to the age with a better condition.
Bunları öz üzlərimizdə əməl etsək, biz qocaldıqca da, daha da yaşlandıqca da, məsəl üçün, hansısa bir xəstəliyə tutsaq belə, daha intensiv və daha yaxın sağlamlıq qabiliyyətimiz artır.
So that's we have in our faculty, because it's faculty of physical education and sport, so we like that. We have motion is our passion. So it means we love the movement, and it's the same if you are a teacher of physical education, if you are a coach, if you are a physiotherapist. We know that movement can change a lot. It's better than take a pills, and you can solve a lot of things by movement.
Bir fizioterapist kimi, yəni onların fakültəsinin əsas bir mesajlarının biri odur ki, hərəkətlər əslində insan bədənini çox şey dəyişdirə bilər. Hansısa bir dərman vasitəsindən istifadə eləməkdənsə, düzgün hərəkətləri tətbiq eləmək daha çox inkişaf göstərə bilər.
And I have been a motto of our department. We'd like to change the world by movement.
Bu da bir afaretim kimi biz dünyanı hərəkətlərlə dəyişməyə
So that's only what we can do, and it can really increase the quality of life of our patients and of ourselves as well.
Yəni ən sadə bir nümunə kimi bu hərəkətlərdən aktiv istifadə ilə öz üzərində əslində söhbət ondan gedir. Öz həyat səviyyəmizi də artıra bilər. Yəni bu da birinci yəni özümüzdən başlayır və özümüz üçün ən keyfiyyətli bir düşüncəsi.
So I wanted to thank you a lot for this time. It was my pleasure, and I hope that it was inspirative for you. There is my email. If you have any question in your minds later on, don't hesitate to write me. And I believe that perhaps we'll meet or in Prague, or I'll come back here because I feel really incredible hospitality here, and I'm coming here like, not for holidays, I'm a little bit tired after 4 days, but my seasons are like academic year starts, Christmas, Baku, academic year, so holidays, academic start, Christmas, Baku, so it's going to be part of my life, so thanks for that. I'd like to say thanks. I don't know. Do you want anything? Ball or the spiky ball?
What's this?
Spiky ball?
I need this one, not this one, you know? I need this one.
Take it. Take it. Then I'd like to appreciate girls, Darina, or what do you prefer? Okay. Okay. Then there are some more. Perhaps Ophelia, I suppose. And next time I will come with more devices and acts volunteer.
Thank you very much. So, yes, I'm appreciate it.
Really? Can we make a photo together?
Yes. Şahşat fotoğraf mı? Yok, fotoğraf mı?
Okay?
Yes.
Fotoğrafım var. Gelin.
Üzben.
Yeah, I'm glad, and so I'll give you something. So I'll find something to give it to you. And I appreciate even your works. You were very active all 4 days. I'm sorry I don't have 4 days. Yeah. So could we make a photo together?
Bence yapma kardeşim.
Someone can go. The small one.
O tarafta oturun, hemen duruyorum.
Cam, batır o cam.
Bir nəfər gəlsin də burada çox adam olur.
Yaxşı, yaxşı.
Nəzin doldurdu boşluğu.
Thanks a lot. Thanks.
Yaz.
I suppose you are part of the romance students, so we are already like cheers by now.
Bir dənə bizim